Hi, my name is Courtney, and I am in Cognitive Psychology, the 2025 fall session. Today, we will be discussing how play therapy supports social cognition for neurodivergent children. Social cognition is how people receive, interpret, and categorize the social behaviors of others as well as themselves. The reason why this is so important is because the earlier you intervene in these children, the more successful their outcomes, the more you are giving them an opportunity to succeed in their future endeavors. So starting with some theoretical background, we're going to discuss Piaget's developmental stages. This goes from birth and up. First, you're going to have your sensory motor. That's just interpreting the environment through your senses. There's also object permanence. This is where you understand that an object is still there even if you can't see it. For example, if your hand is resting on top of your leg, you still know the rest of your leg is there. It's just under your hand. Pre-operational is more of your symbolism, your pretend play. You may see a child grab a plastic straw, pretend to be a witch. You have your concrete operational, that's more of your logic, thought, and reasoning. For example, your child may see a cloud in the sky and say, oh, it's about to rain. There is formal operational, which is more of your abstract thinking, like solving a difficult algebra problem. Theory of mind is very important, especially for children, as they learn that people have different beliefs, different perspectives than they do. As well as joint attention kind of connects to this. You can see in the slide these boys are exhibiting joint attention as they are paying attention to the same object and interacting using that same object. Schema modes, they are important because they're basically the adaptive, maladaptive behaviors that we use when we are overwhelmed in stressful situations. Those four categories have several different subcategories. They are not important for this presentation. However, I will tell you the health categories, they're the only ones that are very adaptive, and they're more of just being very secure in your own body and mind. Moving into cognitive mechanisms, I touched on schema a bit. Schemas, they're just the categorical knowledge we use to make sense of the world. For example, our script schemas, Halloween, funerals, holidays, they all have sort of a script we follow, what we expect, how we act. There's your automatic and control processing and decision making. System 1's more of your impulse. Someone cuts you off in traffic, you call them a dirty word. System 2, that is more of your deliberate, analytical, you're trying to be a better person, someone cuts you off, you just take a deep breath and let it go. Circling back to System 1, you have more of your emotional brain, you see the cerebellum, amygdala, hypothalamus. System 2 is more of your logic, your executive functioning with your prefrontal and cerebral cortex. Your attention is what stimuli you're attending to and which is ignored. For example, you have goal versus stimulus driven. For example, if I tell you to find where's Waldo in the picture in front of us, that's a goal. You're trying to find Waldo. He does not exist in this picture, by the way. And then stimulus is more of what catches your eye. Perception is kind of like attention. We are using our senses to interpret the environment, but we're finding meaning. For example, a fire alarm meaning danger, evacuate. Now, the reason why this is important is because kids, they especially get the foundation of these concepts as they are developing their social cognition and different cognitive processes. However, some kids need a little extra help, and that is where play therapy comes in. For example, we have Chen and Yu Wang, 2024 in Hong Kong, and they had 8 weekly sessions of play therapy, 45 minutes each for 82 children. And what they did to measure the effects of this play therapy was they had 2 different conditions, sand play and storytelling. The sand play, they would have a parent, a lab member, or they would be alone. Parent and lab member would just passively watch, be in the background. The storytelling would have the same three, except they were telling a story. To simulate being alone, they would have an auditory tape of the story. Anyway, they knew that this was effective because they found increased EEG waves with the same situations after the play therapy. The increased EEG waves, that meant that they were more at ease with the situation. There is also some decreased scores in the SRS-2 and AQ child scores. These were very good because if you increase in the social responsiveness scale, then that means, if you decrease in the social responsiveness scale, then that means you're having less social issues. If you decrease on the autism quotient, that means you're less likely to be diagnosed with autism. And the increased ABAS2, Adaptive Behavioral Assessment System, just meant that they had better behaviors in different situations. Now, the group therapy with Syrian refugee children, this is more of like an impact on your PTSD or your acute stress disorders, as these children experienced bombings, things that we could never imagine. So these children went through 8 weekly sessions. 5 out of 10 no longer met PTSD criteria. There is a statistically significant decrease in their CRI score, which means that they were at risk for developing PTSD. And 4 out of 8 of the children moved to a non-clinical SDQ score, which is Strength and Difficulties Questionnaire. And that means they just have more resilience. Now, the group play therapy and ADHD, those results were measured using the CSI and the CBCL. Those both showed decreased social issues as well as aggression. Now, just as a little review, maybe you've heard of these, maybe you know what they are. Autism spectrum is more of your difficulty in social situations and interactions, more restrictive interests and behaviors. ADHD is more of your hyperactivity, very impulsive, not thinking before you act. PTSD means your body just constantly feels in danger. You're constantly in fight or flight, and it can be very hard to function. Applications. Play therapy can be used. It is just such a diverse tool, really. You can use it for memory. You can use it to improve your emotional processing, such as seeing with child-centered play therapy, where they explore different things, they learn how to process. Your directive play therapy, that is more building certain skills, such as memory card games. That would be an example. Now, moving forward, there may be a future with AI in play therapy. An example is the prototype Echo by Bartolome, as mentioned in his 2025 paper. This is actually a little plush toy. It changes colors and makes different sounds depending on what the child is pretending for it to be. This particular prototype could be a frog or an airplane. And that's especially helpful with autistic behaviors, as autistic kids tend to be more restrictive, less spontaneous, and imaginative. Now, the AI agent in virtual reality, that was more of a focus on Down syndrome children that were wheelchair confined. And with this, there would be games that would help with hand-eye coordination, would have collaborative properties. The AI agent would kind of like tailor it to the individual child to give them enough of a confidence boost to keep going, but also just difficult enough to help improve their skills. Now, a little case study here. We have client C, 7-year-old male, 2nd grade, very attention-seeking, defiant, a lot of externalizing behaviors. His treatment was twice weekly, 45 minutes each for 9 weeks. Of course, there's the different stages you have the warm up, establishing relationship with your therapist, exploring the attachment issues, and then building upon the different stages and the success from those stages. Now, the results from this, we saw an improvement in aggression, externalizing behaviors, social issues, even some of his academic work. However, there was no change in anxiety and depression and somatic issues. It is important to note in this study that the home life was perceived to be particularly difficult. In conclusion, play therapy, it is such a valuable tool to help these kids grow and to develop the skills that they need to become successful in this life. It can be tailored to their individual needs. It's evidence-backed theoretical frameworks, and just the earliest that we can apply this to our children is when we should do it. Like, as soon as you notice they need this intervention, and that way they can use all the tools. And here are my references.